Welcome back. Now, all of Kenya's 4 recorded COVID-19 deaths so far have been of people with previous underlying health conditions. Data from the Center for Disease Control and Prevention globally shows that COVID-19 patients with pre-existing medical conditions such as asthma, diabetes, cancer, and heart disease appear to be more vulnerable. However, the good news is that families and the people in this high-risk population can take extra precautions to stay safe. Dorcas Wangira tells us how.
Captain David Kimuyu Kibati, a senior Kenya Airways pilot, paid the ultimate prize to evacuate Kenyans from New York, a city and state that is now the epicenter of the COVID-19 pandemic in the United States. Captain Kibati, who was taken ill on March 29th, died on April 1st, a week after performing his last international assignment before the government's ban on international flights took effect last Wednesday.
Kenyans owe him a great deal.
Captain Kibati's death was recorded as a COVID-19 death. However, he had been diabetic. Kenya's first COVID-19 death was of a 66-year-old Kenyan who was also diabetic while he was at the intensive care unit of the Aga Khan Hospital. Ursula Buluma also died of COVID-19 in Mombasa. The long-time employee at the port was nearing retirement and is said to have had an underlying health condition before she contracted the virus. Kenya has lost one other patient to COVID-19, a 6-year-old boy with a pre-existing condition also succumbed to COVID-19. We asked Dr. Eubrin Mora just what exactly is a COVID-19 death.
For you to call it that this death has been caused by the virus and you directly link the complications that are caused by the virus attributed to the virus itself, that's when you can call it, you can directly link it to the virus and label it as a COVID-19 death.
Has also not stopped all other infections. It has not stopped all other diseases.
People are still infected and are living with other illnesses and conditions such as diabetes, kidney failure, cancer, and heart disease.
But then when they develop the virus, the viral infection from COVID-19, then they tip over and get respiratory symptoms that result to them not being able to breathe well, and then subsequently they die. For example, someone with diabetes, their immune system is already suppressed because of the diabetes itself. The high sugars in the blood then affect how the cells of the body, which is the army of the body, the immune army of the body, on how it responds to infection. There is a defect in patients with diabetes. What about patients with cancers? The same thing.
Is it possible, one may ask, to test positive for COVID-19 but die from another condition?
If we can attribute acute respiratory distress syndrome to the COVID-19, then we say, okay, fine. You know what, this was COVID, but this patient was also diabetic, this patient still had asthma, or this patient was a smoker, or this other things that was still can be underlying in the same patient.
Data from the Chinese Center for Disease Control shows that the proportion of people who have died after testing positive for the virus is higher for patients with COVID-19 who already had pre-existing conditions. Out of 540 deaths for 20,182 cases, 10.5 had cardiovascular disease, 7.3% had diabetes, 6.3% had chronic respiratory disease, 2.6% had undetermined pre-existing conditions, and 0.9% had none.
Particles get into the lungs, and then that's how they spread out. But if they get into the lungs, then the first line of defense, which are some cells that are in the lung that are supposed to fight it, are defective in one or the other, or the structural integrity of the lung is messed up because of, let's say, asthma, or having had TB before, or having had some drugs that messed up your lungs, then you're at a more likely risk. COVID does not select. So far, what we hear is that we're having even younger people dying from this, and we even witnessed in our country that we lost a child.
In the United States, data from the American Center for Disease Control show that patients with chronic renal disease, cardiovascular disease, immunocompressed conditions, and chronic lung disease require medical advanced treatment and are likely to end up in the intensive care unit. But what should this vulnerable population do to stay healthy?
To make sure that we shield these people. And how can we shield these people? It's this infection control measures that we are trying to put into place: social distancing, isolating people, making sure we have respiratory etiquette, we are ensuring good hygiene. But again, the individuals that are vulnerable need to know that they are vulnerable. Have to put those measures into place externally, to make sure that as an individual I'm protecting my family member, my friend, my spouse that could be a risk. But then that individual themselves, after realizing or after having the knowledge that they are at risk, then they have to put measures to mitigate them.
Families of patients should make adjustments to ensure that the vulnerable are shielded. This is by taking simple steps such as going to the shop instead of them. At this time, more health workers are also needed to bear the disease burden. Dorcas Wangira, Citizen TV, Nairobi.